If you love iPhone, you'll love Apple Card. It comes with the privacy and security you expect from Apple. Plus, you earn up to 3% daily cash back on every purchase, which can automatically earn interest when you open a high-yield savings account through Apple Card. Apply for Apple Card in the Wallet app, subject to credit approval. Savings is available to Apple Card owners, subject to eligibility. Apple Card and Savings by Goldman Sachs Bank USA, Salt Lake City branch. Member FDIC. Terms and more at applecard.com. If you love iPhone, you'll love Apple Card. It comes with the privacy and security you expect from Apple. Plus, you earn up to 3% daily cash back on every purchase, which can automatically earn interest when you open a high-yield savings account through Apple Card. Apply for Apple Card in the Wallet app, subject to credit approval. Savings is available to Apple Card owners, subject to eligibility. Apple Card and Savings by Goldman Sachs Bank USA, Salt Lake City branch. Member FDIC. Terms and more at applecard.com. You're listening to Wellnow, Slate's podcast on health and wellness. I'm Kavita Patel.
And I'm Maya Feller. Living in New York, I feel like I can find a cannabis dispensary on just about every street corner, including in my own neighborhood. Kavita, is that the case for you in DC?
Oh, definitely. We are not as densely populated as New York City, but we still have dispensaries everywhere. Many people around here travel between Maryland, the district, and Northern Virginia, and all three have legalized recreational marijuana for adults. Basically, it's pretty easy to get it here.
Yeah, that's the same. It's also legal in New York State. In fact, this year, nearly half of states, 24, and Washington, D.C., have fully legalized marijuana. Another 13 allow it medically. Back in 2014, Colorado became the first state to legalize recreational marijuana, paving the way for more states to do the same over the next decade. And understandably, the more states that legalize it, the more people report using it, especially among young adults.
That's right. Nearly 14% of people between the ages of 18 and 25 say they use cannabis almost every day. That's according to the 2022 National Survey on Drug Use and Health. And it's more than double the amount of frequent users recorded in 2002. And get this, Maya, using data from that same survey, the medical journal Addiction published a report saying that 2022 was the first time more Americans frequently used marijuana than those who drink alcohol nearly every day. That's pretty astounding if you ask me. What do you think, Maya?
I mean, that is astounding, Kavita. Wow. I mean, I guess that's why New York smells the way that it does.
Yes.
But you know, what's more alarming to me is now the more people that are habitually using marijuana, we're actually starting to get a clearer and what I would say is distressing picture of the side effects related to the drug.
So I'm a recovering addict and I'm not a hardcore IV drug user. I'm a pothead.
What's up, everybody? Back in the hospital again. It's the third time in 3 days.
It literally put me almost, I swear to God, in psychosis. I was catatonic. I could not move. I could not speak.
Good morning, sir. What brings you in to see me?
Doc, I have been vomiting all the time and I can't figure it out.
And it's characterized by scream vomiting.
Now, to be clear, most people who've used cannabis in some capacity don't get these kinds of symptoms. However, chronic users, they do have a likelihood that's higher in getting them. And since there are more chronic users nationwide, we really wanted to get a fuller picture of what's at stake.
That's right. So after the break, we'll be joined by a physician who's seen a rise in the number of her patients showing these alarming symptoms.
Just because something grows outside does not mean that it is necessarily good for you to consume.
We'll get her view on what's missing in the national conversation about marijuana use. Stay tuned.
Well now, listeners, if you're enjoying the show and want to hear more, subscribe to our feed. New episodes come out every Wednesday morning. While you're there, check out our other episodes too. like last week's, where we dive into all the big feelings and occasional discomforts of puberty with author Vanessa Kroll-Bennett. She's a puberty expert and co-author of the book, This is Awkward, Modern Puberty Explained. Check it out.
If you love iPhone, you'll love Apple Card. It comes with the privacy and security you expect from Apple. Plus, you earn up to 3% daily cash back on every purchase, which can automatically earn interest when you open a high-yield savings account through Apple Card. Apply for Apple Card in the Wallet app, subject to credit approval. Savings is available to Apple Card owners, subject to eligibility. Apple Card and Savings by Goldman Sachs Bank USA, Salt Lake City branch. Member FDIC. Terms and more at applecard.com. If you love iPhone, you'll love Apple Card. It comes with the privacy and security you expect from Apple. Plus, you earn up to 3% daily cash back on every purchase, which can automatically earn interest when you open a high-yield savings account through Apple Card. Apply for Apple Card in the Wallet app, subject to credit approval. Savings is available to Apple Card owners, subject to eligibility. Apple Card and Savings by Goldman Sachs Bank USA, Salt Lake City branch. Member FDIC. Terms and more at applecard.com.
Fever, cough, congestion. When the symptoms keep coming, but you've got to keep going, you can rely on Mucinex Fast Max All-in-One. Just one dose of Mucinex Fast Max All-in-One relieves up to 9 cold and flu symptoms, helping you get on with your day. Need cold and flu relief? Get Mucinex Fast Max All-in-One and Done Relief. It's comeback season. Use as directed.
Welcome back. You're listening to Well Now. I'm Maya Feller.
And I'm Kavita Patel. As marijuana use rises nationwide, more people are arriving at the doctor's office with concerning symptoms, particularly people who use the drug habitually. Dr. Brittany Tayler is an internist and a pediatrician based in Michigan. She's also an assistant professor at Michigan State University's Hurley Pediatric Public Health Initiative. She has a long history of working in her community, especially around issues of tobacco and nicotine use, as well as cannabis and substance use disorders. Brittany, thank you so much for joining us.
And thank you so much for having me. I'm really excited to be here.
So we're really looking forward to this conversation. Before we dive in, we always ask our guests this question. So Brittany, how do you define wellness?
I was thinking about this before because of the name of the podcast. And I think it comes down to the fact that wellness can be so many different things to different people. And I've heard a lot of people talk about this, and I think it comes from the WHO's definition of health, but it's not just the absence of illness, but it's also more than that. It's going beyond kind of that neutral state. But I think for some folks, it means a lot of different things, whether that's physical, mental, emotional, spiritual health as well. And that it's this constant process that we're striving to, and that there's going to be dips and kind of surges with all of those sorts of things to kind of get you to that equilibrium, which is hopefully wellness for you. And that might not look the same as somebody else's wellness. So for me, it's being happy and hanging out with my friends and my family.
That's great. That's a great way to apply wellness. It's very individual. Can you tell us, Brittany, a little bit now, diving into the topic, how your view and the view overall has changed in regard to marijuana use since you first began your career in medicine?
I think it's just significantly changed even since I was younger. And I know I'm not the oldest physician that I'm working with or provider that I'm working with by any means. But since then, there's been this huge shift from this substance that was illegal and you weren't going to talk about it. And if your patients used it, you might need to report them to something. It was this horrible thing that you wouldn't be using, to now something that it's very mixed bag all over the place, where there might be some benefit and we're not 100% sure about a lot of different things. But I always use the example that when I was in training, we made this huge shift when I was a pediatric resident, where we would always do urine drug screens on women. And there's a lot of health equity issues that go into that as well, but that during that time, we made a shift to where I was practicing, where if a woman tested positive for THC or marijuana, we made a big decision that we were no longer going to call Child Protective Services. And I think that kind of epitomized kind of where medicine was going in terms of its understanding and acceptability of individuals using marijuana and what it meant for the health of themselves and their children. And so it's just been a huge shift from this demonized product to one that's just very commonplace, and one that we as medical providers need to be really comfortable talking to our patients and our colleagues about, and how that intersects with what we already do in medical care.
Mm-hmm. And as people are being more open, providers and patients themselves in offices, we're really starting to see this rise in habitual use. And then there's also these negative side effects that are related to that habitual use. Can you tell us specifically what those side effects are?
So there's quite a few, and I think the big ones I think folks should know is that it can be addictive. And I think that's the biggest side effect. I don't think people always consider it a side effect. They consider it just part of the use. And that's a big one. Another one is withdrawal. You can definitely 110% withdrawal, especially if it's a very chronic use and habitual use with that. I think two of the bigger other kind of side effects that you can get that we talk about too, that are unique to cannabis as opposed to another substance, is cannabinoid hyperemesis syndrome, which is a very fancy, long way of saying this specific disorder that happens where an individual will have 3 to 4 days of very, very severe vomiting. And I'm talking like 30 episodes of vomiting a day. Oftentimes has a lot of abdominal pain associated with that, and it will just kind of resolve spontaneously on its own after 3 or 4 days. And this happens in a cyclical way that'll happen almost every month or every couple months. And that's a very unique thing to cannabis. Another one that's come up a lot has to do with the psychosis symptoms, which is where individuals are coming in having almost like episodes where they're just not themselves, where they kind of lose a span of time and memory. It's very similar to almost someone that has schizophrenia or a more significant mental health disorder. And often this will happen in conjunction with a young person potentially being diagnosed with that eventually later on. And you can see various shades of this. There's kind of on a spectrum for a lot of that. So the psychosis associated with it is a big other thing that I like to usually warn and discuss with my patients.
Mm-hmm. So, Brittany, you touched on youth. Is there a difference between how adults and children present with these symptoms?
Yes, most definitely. So adolescents can handle a lot of substances a lot differently than adults can. Children are not little adults. And so their brains can handle a lot of these neurotransmitter substances a lot differently than an adult can. So they can actually tolerate much higher doses without the kind of withdrawal and negative effects and get a lot of the more benefits, quote unquote, for some of these. And so sometimes it can be much more difficult for an adolescent to see that they're addicted or having a withdrawal symptom because of that. And it actually can affect the wiring of the brain chemistry earlier on. And this is why, we've really pushed in the last couple of years, now the drinking age has been 21 for a long time. Now tobacco, just in 2018, is 21, and places that have recreational marijuana, it's always 21 as well, because we recognize that cannabis, THC specifically being that psychoactive component, does affect the brain chemistry a lot differently, and so can actually hardwire for addiction and different things down the line.
And Brittany, just to follow up, when you speak about the quote unquote benefits, you mean that kind of psychoactive feeling?
Yeah.
Okay. I just wanted to make sure, the high, as I guess people would proverbially call it.
Yeah. The anti-anxiety and euphoric properties of cannabis can be experienced to a much greater extent for adolescents whose brain chemistry hasn't fully developed yet. And so they can really, really enjoy it. And sometimes it can help them focus a lot more, decrease a lot of that anxiety. And a lot of it is kind of difficult to kind of tease out, because I remember being a teenager. It's a very stressful time. So anything that kind of helps bring that down just seems like a miracle.
Right.
So for a lot, it might be just the situation as well.
Yeah, no, that makes sense. And how do patients, maybe whether they be adolescents, their parents, or just an adult on their own, whenever you've had to kind of make that connection for patients about their symptoms and their cannabis use. In general, can you paint a picture about how they've reacted?
A lot of times, especially, I think the times that it comes up and it's the most difficult is when someone's come in with the cannabinoid hyperemesis syndrome and they're just so severely sick, and it can be really frustrating because the only way for them to not have that symptom again, not to have another episode of that, is to stop using cannabis. And it can be really difficult for them to accept that as the primary reason, the primary curative thing that's going to help. And also, there's still a whole lot of not believing, not trusting, thinking that I'm doing it for a different reason, that I have this idea that you shouldn't use cannabis at all, and this is my way of doing that. And I think we use obesity in a very similar way. And so sometimes, somebody will come in with knee pain and they'll say, well, if you just lost weight, it would be better. It's not the same when I'm talking about cannabis and cannabinoid hyperemesis, but that same kind of feeling of like, don't blame this thing that's happening to me on my cannabis. It helps me in so many other ways. I can't imagine my life without it. So it can be very, very difficult. You end up having to tackle the primary reason that somebody is using it, especially in this significantly habitual way.
And when they do stop, or when patients and kind of in counsel with you decide to reduce or stop their marijuana use, what have they told you about their symptoms going forward, or what have you witnessed?
Almost all of my patients have had resolution and not had another episode of cannabinoid hyperemesis. And I've actually had a few where they may have had another episode about a month later, but never more than one. So it's been fairly successful in that way. And I have had patients as well that have been abstinent for quite a period of time, haven't been using cannabis in whatever form, and then would go back to it. Oh, I went out enjoying some of the time with my friends. I took a couple of hits, and then would have the symptoms again. Unfortunately, like this last week, I had a 18-year-old who came in and she had symptoms again after she had just for like 2 days had started using. She was so frustrated about it. So it can be really successful when you stop, but it can just be really, really difficult for individuals to stop because often it's filling some sort of need for them. They're using it in that therapeutic way that the healthcare system hasn't been able to fill that need for them in whatever other way, and they just feel more comfortable with it. And so a lot of times you have to figure out a game plan to fill that void.
We're going to take a break here. When we come back, we'll hear more from Dr. Brittany Tayler about some of the biggest misconceptions surrounding marijuana use and what needs to change going forward. Stay tuned.
Get softer, smoother, and more even-toned skin after just one use with the new Gentle Exfoliating line from Cetaphil. Formulated with a unique triple acid blend that promotes surface skin cell renewal, these gentle chemical exfoliators remove dead skin cells and refine skin's texture while hydrating, resulting in softer, smoother, more even-looking skin. Shop the new Cetaphil Gentle Exfoliating line in the face and body aisles at your local Target store or online at Cetaphil.com.
Time to move? Skip the hassles of selling during the holiday season and sell your home directly to Opendoor. Request an all-cash offer in minutes, close, and get paid in days. You can even pick your close date so you can move after New Year's. Start your move at Opendoor.com or download the Opendoor app. Opendoor is represented by Opendoor Brokerage Inc., license 02061130 in California, and Opendoor Brokerage LLC in its other markets. Terms and conditions apply.
You're listening to Well Now from Slate. I'm Kavita Patel.
And I'm Maya Feller. We're continuing our conversation with Dr. Brittany Tayler on the growing number of people exhibiting negative side effects from marijuana use.
So, Brittany, let's do some truth squatting about marijuana because there have been some pretty sweeping statements about it in the past, such as marijuana is not addictive or that marijuana is much safer than alcohol. How do you respond to statements like that? And what are some other commonly held beliefs about marijuana that you'd like to give more context to?
I always get so frustrated when people say that it's not addictive, because it can 100% be addictive. One, you can be addicted to absolutely anything, whether or not there's an actual biochemical process that happens in your brain that drives that. And with cannabis, there is 100% a change in the brain chemistry that happens from that, which can drive that addiction. I always say when I'm talking to schools or talking to parents, when someone continues to do something, despite knowing that it's negatively affecting their lives and that they have to go out of their way to do something, and they know that it's having a negative impact, but they continue to do that, that's addiction. So whether or not the brain chemistry is involved at all, that is an addiction. You're doing something despite that. And I see this a lot with cannabis, whether it be from the negative health effects or how it's impacting their job, their school, their career. And it's 100% one of the reasons that you could say, yeah, this is 100% an addiction that's going on right here. This is an addictive behavior. For someone who works in like the nicotine space, I always hate when somebody tries to compare it to something else, because it's not about demonizing one versus another. And I think that everything can be enjoyed in moderation. It just moderation looks a lot different. So alcohol isn't necessarily worse or not better. It's kind of apples and oranges. And so I think a lot of people always cry about that, or again with tobacco. And there's room to have many things that are not great for you. Unfortunately, like we don't want lead or arsenic in our wells, but talking about one or the other doesn't take anything away from that. So, and I think one of the other commonly kind of held beliefs about marijuana is that it's safer than other pharmaceuticals because it's a natural product. This kind of concept that it's a plant and so it's natural. And I always get really frustrated because I was like, hemlock is also a natural product and you would not want to take that. And I always also compare to the fact that so many of the substances that we use now in pharmaceuticals are a synthetic version of some sort of phytochemical. Like I think of aspirin and salicylates. I mean, that is 100% tree bark that we got that from. Penicillin is from a certain kind of bacteria. So many, like the way that statins were made from red yeast rice extract. There's so many things that are based on that again, it can be and it can't be. But just because something grows outside does not mean that it's just necessarily good for you to consume, especially if you smoke something. I think it's a huge issue is that for some reason people have this concept that smoking cannabis is so much safer than any other version of smoking anything, when honestly, breathing any sort of smoke into your lungs is not good. Your body does not enjoy that. If you've ever sat next to a fire before, you would know that. And so it's not necessarily worse than nicotine or tobacco, and it's not necessarily better. So a lot of times when I'm talking to my patients, we talk about different ways to use the product that are less risky or might be less harmful. And I really usually try and kind of get them away from smoking the product because that has a lot of carcinogenic effects just from that. So I think that's a big thing is because it's a plant, it must be good for me, or it must be well regulated, or it must be all of these sorts of things. It's just unfortunately not the case.
And in your estimation, Brittany, how would you say we got to this point? I mean, the things that you're telling us about, commonly held beliefs, you're really myth busting here. Mm-hmm. But there's such a lack of nuanced information about how marijuana does in fact affect the body. How did we get here?
I think unfortunately and I'm not a negative person, but commercialism, when they got a hold of marijuana, they saw what this was going to become. And that really was driven this explosion of using cannabis and marijuana products. And I was just recently looking at a study and they were saying that the majority of people, if you ask them, hey, I have a health concern about my marijuana or my cannabis product, who would I go and ask for advice from it? And almost entirely, it was always someone who was dealing. So like not necessarily, could be legally selling them the product, but they're often going to a cannabis retailer and asking for advice. And I don't think that that's a bad thing, but this is also something that they are trying to sell you. They're trying to sell you this product that is going to work in a certain way that they believe it to be. And they don't always know about all of, know the health impacts. They don't know about your other medications that you're taking. They don't know about how the biology of, smoking works and the lungs and different things like that. And I think so many people are just getting it from a retailer who, again, has an agenda. Even if they're good people, they still want to sell the product. They still believe in that. And we can see from the way, with nicotine, with tobacco, how many different faces that they put on in order to sell a product that they knew at the end of the day was probably not good for them. Unfortunately, commercialization really changes the spirit and the soul of this. And so it can corrupt it even when things are supposed to have been good from the beginning. I think if you've ever thought about e-cigarettes in Juul, they really wanted to take on the tobacco industry and ended up kind of getting taken over by that desire to, profit margins, et cetera. And it's unfortunate because I do think that cannabis probably does have some benefits. There's a lot of data that's all kind of all over the place with this, but where people are getting their information is not an unbiased source.
Right. And people clearly do not realize that. And there's also the policies around this, which I think can be somewhat confusing to navigate. Can you tell us a little bit, Brittany, about, we know that there have been efforts to loosen kind of the federal restrictions on marijuana to reclassify it from a Schedule 1 to Schedule 3 drug.
Look, folks, no one should be in jail merely for using or possessing marijuana, period. Far too many lives have been upended because of failed approach to marijuana, and I'm committed to righting those wrongs. You have my word on it.
Which means that marijuana would remain federally illegal, but it would be easier to do research on it in the future. Do you think this will help clear up confusion about marijuana use?
I'm not against it by any means. I think that should probably be the direction that we're going. But one of the biggest pushes for this reclassification is that it allows for the cannabis retailers to now get a tax break that they weren't allowed to do before if something is a Schedule 1. Because if you're a drug dealer selling cocaine, and it might be your business, but when you're doing stuff across state lines, you're not allowed to get a tax break for that business that you're allowed to do. So the big thing is when it reclassifies it, it will help that. It will help a lot of the individuals who are cannabis retailers right now. There's a small part which will also make it easier when you are doing federally funded research to make it a little bit easier to handle the substance as well. But a lot of the folks that I work with, and myself included, feel that at this point the American population doesn't use cannabis in a very controlled way. They use it in a very organic. I got it out from my retailer. I have a lot of different percentages. I use it kind of all over the place. It's not like a medication that I prescribe it. And so studying it in the way that would require me to actually possess the cannabis to give to them might not be as effective as we'd like it to be. It really needs to be more population-based, where people are out in real life using real life cannabis. That's going to tell us the most about actual use patterns and the long-term and short-term effects of this, as opposed to something driven, more by a lab that I give you out my placebo cannabis or not. And so I think a lot of the claims around it going to help so much with research are a little bit overblown. It really will help more with, again, that taxes, and helps a little bit move more towards some decriminalization. But states have already done that all by themselves, so they don't need this federal regulation to do that.
And so, Brittany, what do you think, what else would need to change in order to have better care for patients who are having negative side effects from cannabis, like the CHS? And what do you feel like is at stake if we don't make some changes?
So I think that some of the biggest things is being more streamlined and more routine in the way that we sell these products, and being more upfront about these possible concerns. So we label the back of an alcohol bottle or tobacco because we know that these are negative effects. So they're on there and the consumer is aware of them, that these are risks that you take when you use this product. It doesn't happen to everybody, that it can happen to you. And unfortunately, there is really, and a lot of this is because of the national ban on it, we don't have any national regulation about this. So it's all over the place. There's lots of states doing different things, and it's not really clear what's going to be the most helpful. Even the way that cannabis is tested by a retailer is going to be totally different depending on what state you're in. And until we do something that's a little bit more streamlined and more evidence-based, and we know what those best practices are, it's really, really difficult to do this in any sort of effective way. And I can understand as a consumer, you would be super confused about what you're supposed to be doing or what's the best, and reading on the internet and different things like that. And I think kind of to go hand in hand with that, the other thing is that medical providers need to know about this. It is one of the most commonly used substances in the United States. It is not going away anytime soon. We can't just pretend that it's not happening and that it doesn't affect our patients, whether that be our 12-year-olds to our 82-year-olds. They're all using it in different ways. And it's good that we need to be comfortable and open and know how this affects people's bodies. So kind of a call for all providers to start learning more about this. So it always makes me laugh because my colleagues are always like, oh, this person uses marijuana, they should go see Dr. Tayler. And I'm like, if I saw everybody who used marijuana, you guys wouldn't have anybody to see. You'd only have like this little group of people. Like, everybody's got to know about how this affects your body.
Brittany, can I ask just to follow on that? So if you were, this is a wide audience that's listening, some of which include health professionals, where could we point people to for evidence-based information, something that, I just think of the times when I've tried to guide patients through tobacco cessation, the stop, the quit program, and trying to kind of get people practical information about this. Do you have anything that you point patients to?
So some of it is through the American Academy of Pediatrics. They have awesome things that talks a lot about what the health harms are, and they give a lot of advice, like if you're a parent or you're an adolescent about this. The Truth Initiative also, which I think people classically think of as being a tobacco youth advocacy group, has a ton on cannabis. So if you want to talk about like the health harms, especially at kind of an adolescent to young adult level, it's very, very approachable and really nice to kind of engage in those, as well as talking about kind of some of the myths and the trends and the different things around that. So those are two of the big ones that I think I talk to with my youth about.
I think there is also, I'll put myself in this category. I work at a federally funded community health center. I certainly screen for it, but I think there's such an aversion to having anything that appears like we're violating federal rules, to be candid. So, but I might send everybody to you because you're right. It's so pervasive. And I've never, unlike a lot of things where I get CME and I'm getting constant education on, this is not a topic we get education on.
Same in dietetics. We have no conversation about it. I mean, maybe the only thing we talk about is Marinol for people who are experiencing side effects of chemotherapy or other medications.
Yeah, it is a disservice that we don't have this regularly available for medical providers. So SAMHSA has a wealth of information for medical providers as well as for the public as well.
And SAMHSA, just if people are listening, the Substance Abuse and Mental Health Services, count that as one of the many acronyms I had to learn when I worked in government. But it is a great resource.
And so does the National Institute on Drug Abuse. And so they do a ton around, Delta 8, about CBD, synthetics, what are the short and the long-term effects. They talk about cannabinoid hyperemesis syndrome. But if you wanted something that was more for a medical provider, I would say that SAMHSA has a ton of information. They have so many different webinars which go through this pathophysiology. And they honestly have a center of excellence in Colorado that has a ton of informational webinars, exactly like how do I as a medical professional talk to my patients about this? And like, what are the things that I should be looking out for? I'm always very conscious about not probing unless it's going somewhere. I don't want to ask somebody a bunch of personal questions about their cannabis use if it's just so I can type it up into their medical note. That doesn't really, do a lot. But if this is going to change the way that I might counsel them about a different medication or their lifestyle or different things like that, what are the sorts of things that I need to talk to them about?
Brittany, would you leave us with perhaps a piece of advice for a hypothetical listener? So one of them is a young person And then the other one is an adult. So what would be a piece of advice that you would give each of those?
I think it almost might be the same. Be critical, be suspicious, and be skeptical when you're using any product, whether that be cannabis or alcohol or nicotine or a supplement or anything that is a catch-all cure that's going to fix all of these problems and has no negative effects, because everything is a balance. Everything has to be in moderation, has to be at the right time. And what works for one person might not work for another. And that's okay, because we're all different. And the science is always evolving, and it's one of the best parts of making us human.
Dr. Brittany Tayler is a pediatrician and internist at Hurley Medical Center and an assistant professor at Michigan State University. Thank you so much for joining us.
Thank you for having me.
That's our show this week. Well Now is produced and edited by Vic Whitley-Berry. Ben Richmond is Slate's Senior Director of Podcast Operations. Alicia Montgomery is Vice President of Audio. If you have a wellness story you'd like us to cover, let us know by emailing wellnow@slate.com.
And we'd love it if you supported our work by becoming a Slate Plus member. Don't worry, you'll also get great perks like listening to this show ad-free, receiving bonus episodes of Well Now, and tons of other Slate podcasts. Become a member today on Apple Podcasts or Spotify. You can also learn more at slate.com/wellnowplus. And be sure to tune in next Wednesday as we tackle another part of the wellness industry. I'm Kavita Patel.
And I'm Maya Feller. Thanks for listening.
I said to Roger, the last thing you are fair and balanced. That should have been my slogan.
When the Fox News Channel first went on the air, it promised to change television.
Few broadcasts take any chances these days, and most are very politically correct. Well, we're going to be different.
It's going to be kick-ass, and I want to be part of it.
I'm Josh Levine. In this season of Slow Burn, we'll look at the moment in the early 2000s when Fox News became a political and cultural force.
I'm okay with wearing an American flag, and if you're not, I think you need to examine who you are.
You'll hear from Fox insiders, many who've never spoken out before.
I was not told about that beforehand, for good reason. I wouldn't have gone along with it.
And you'll hear from the activists and comedians who tried to stop it.
He said, "You're being sued by Fox." I went, "Really? That's fabulous."
Slow Burn Season 10, The Rise of Fox News. Hear the entire season now, wherever you listen.